buenas noches, son las 19 horas con un minuto del lunes.
Good evening. It is 7:01 p.m., Monday, June 1st. We are in the National Palacio in Mexico City. We're going to begin the daily press conference about the COVID-19 situation. Today, we're going to have three sections. First is the daily technical report. Next are the weekly aspects of the technical report. Particularly, as I mentioned yesterday, we're going to look at each of the epicurves for the cities that are most representative to illustrate where we are and how some are on the rise, some are at their peak, and some are on the downslope. And then in a minute, Mr. Robledo Aburto from the Mexican Health Ministry is going to be here to talk about his work coordinating the technical group and the authorization of work in accordance with new protocols for what we refer to as the new normal, that is health measures in work. And we'll continue to discuss how we're going to go about that, what concerns could arise, and we will welcome questions in that regard. And so I would ask Dr. Alomia to present the technical report and the epicurves, and then we will go on to what Mr. Robledo will present us. Thank you very much, Mr. Secretary, and good evening to everybody. We're here in the evening press conference number 44, and today we are beginning the first day of what has been referred to as the new normal, right? And so as you can see on the calendars, this new normal depends on the Risk Stoplight for COVID-19, which is a stoplight which, based on an analysis of metrics, is going to evaluate risk and then communicate that to the population, but not in a generic nationwide context, but rather for each state. Each color on that stoplight for each state comes about from a result from an analysis of 4 metrics for each state. Depending on how these metrics are at any given time and the interplay between them, that will produce the corresponding color on the stoplight. And then of these 4, red, orange, yellow, or green, in turn represents actions or activities that would be allowed in a given state. Red, which represents extreme risk, basically refers to restrictions for social distancing that happen during the social distancing initiative nationally. This week, as of this week, there have been 31 states in red, and so actions and measures for social distancing are still in play there. Insofar as those states begin to lower those metrics, which have to do with the spread of the disease and the risk of contagion or hospital system being overwhelmed, they can work their way through the system towards orange or yellow, or in the future green, which would allow the population to partake in more activities. And so this is an opportunity for the population to take a look at what color their state is in at a given time and what actions in turn would be allowed based on the color that is going to be updated in each state for each work. And so let's look at the global perspective. We'll move on to the next slide. 24% of cases that have been confirmed have an onset of symptoms for the last 2 weeks. And so we're talking about the active portion of the pandemic, and that's a percentage that has remained steady over the last 2 weeks, approximately. And then we'll see how the proportion of cases in the Americas, where we are located, obviously has also remained steady at about 54% over the last few weeks, And what's been evident day to day as this has gone on is how the pandemic in Europe continues to decline, and that is based on spread in other regions. And so the Americas, led by countries like the US and Brazil, as far as the amount of cases or the burden thereof, go into this large percentage of the active pandemic. And so let's look at the national domestic figures on the next slide. These are the number of people. 282,000 approximately people have been considered suspected cases of COVID-19, and considered a suspected case, somebody has to develop, show at least 2 of 3 symptoms that are the ones that are most commonly found in patients who suffer from COVID. So cough and fever and other symptoms. And so these could go along with an intense cold, and that would be considered a suspected case and thus studied or tested. And so for these people who went through intake, they take a sample to be able to do a lab test, which would be a swab, a nasal swab, or a throat swab that allows the presence of the disease in the respiratory tract to be detected. And so this is the amount of negative cases that had no amount of SARS found in their respiratory tract, and of 93,000, over 93,000 tested positive for the presence of SARS-CoV-2 in their respiratory tract and had symptoms, and so that's considered a confirmed case of COVID-19. Nonetheless, out of this amount of cumulative cases since the beginning of the epidemic in Mexico, only 16,303, which has always been around 20% of the cumulative cases, are cases that are confirmed to be active confirmed cases. So those are the people who had an onset of symptoms within the last 2 weeks. And as such, they're the people who could continue to transmit or spread the disease and thus propagate the active epidemic in Mexico. And we'll see the distribution of these cases by state here shortly. And so unfortunately, there have been 10,167 people thus far who have lost their lives due to COVID-related complications within the Mexican state. Let's move on to the next slide. And so here we see the cumulative burden of disease, which is to say the amount of confirmed cases is at 93,435. Last week, at the end of the week, there were only 5 states in the top tier, which 2,000 or more confirmed cases. This week, we have 2 more states, so now 7 states in total that are at this top tier. And we see the darker colors in this slide, which is the one that shows the cases accumulating day after day. And so let's look at who those 2 states are that joined this top tier. It's Sinaloa and Puebla. Given that they have more than 3,000 cumulative cases since the beginning of the epidemic, and they join Veracruz, Tabasco, Baja California, State of Mexico, and Mexico City, who are the states or the federal entities that have had this spread because they've had the epidemic for longer and thus have accumulated more cases. Other states are still at the lower part of the burden of disease curve, which is they're just now starting to see their spread phase. And then depending on public health measures taken, each state could take on more or fewer cases. And now let's take a look at the burden of disease for the last 14 days or 2 weeks, and with how the epidemic is spread throughout Mexico. We don't see very intense colors here, just in Mexico City. At the top end of this scale, 10,000 cases, and the brighter colors show us what states in the last 2 weeks have been showing this burden of disease. The next slide also shows this distribution with cumulative numbers for each state, Mexico City having topped that amount. And we're going to see how in the next few days, other states move in terms of the number of cumulative cases. And so this is the incidence rate cumulatively per 10,000 inhabitants. There's 12.7 people or cases per 10,000 inhabitants nationally, but you can see that there's a different spread here depending on the population base, which is to say the number of people that live in a given state. That will differ state to state. And so depending on that population density, for example, in the northern states, they have, and there are larger population density than states in the middle or in the south of the country. And so you see the incidence rate, and we can compare what the effect is, what the spread is. And when we're looking at the last 14 days, we can see where the largest amount of activity, viral activity, is in Mexico, and they're the states that have the darkest colors here on the map. And so if we move on to the next slide, we'll also see this distribution, keeping in mind that the green bars represent the incidence rate that we saw on the prior map, which represents the incidence rate for the last 14 days to date. That's why it says May 19th through June 1st. That's 14 days in terms of the window for look back. And so from the last week, we have a brownish bar on the graph that represents the same incidence rate, but for a 1 week look back. So what were active cases looking like for each state, but 1 week back. And so this allows us to compare, for example, for states like Mexico City and Tabasco, where the green bar is higher than the brown bar. That means that the incidence rate in the last 14 days is larger than what we saw for that same 2-week period, but 1 week back. And so that rate has surpassed what it was last week. And so, for example, Baja California, or Tlaxcala, Morelos, where those bars are about equal, that means that that incidence rate has stabilized. Or so the number of cases within the last 14 days compared to what that looked like a week before is the same. We're seeing the same incidence rate, which is to say there is not a growth in spread. And finally, for states that have the brown bar larger than the green bar on the graph, which would be, for example, Querétaro, it's basically Tlaxcala, or we can also say Coahuila. Those are states that the incidence rate a week ago was greater than what it is now. And as such, at least over the course of this week, there was a lessening of spread and recent viral activity. And so if it continues we'll see over time, daily, if that trend continues as this weekly comparison is updated. And so let's look at the next slide. So this is the distribution by date of death among deaths that have happened. There are still 851 of those deaths that are still awaiting a lab result. And as such, those bars that include these light orange segments at the top of the bar could still, at a given moment, grow towards that point. You can see an observable upward trend from the first week of May. After the first week of May, there's a stabilization, which, because of the lag in information, if we take away the last 5 to 7 days, we are still on a plateau, and we'll see what happens this week in terms of this trend. And so the next slide is the epidemic curve. This is the distribution of this same distribution of deaths for these states and for what we can expect in terms of cases to be confirmed, one of which is the light orange segment of the bar. And so let's look at the next slide. And so this is the epi curve. We'll see how the majority of the suspected cases are concentrated, especially over the last few days. Remember that this is a distribution by onset of symptoms. And so they are distributed days ago in terms of the symptoms. And then as we're getting laboratory results, we can see how the dark cherry colored bars are, which are cases that are confirmed by a lab result, but we're still seeing an upward trend in this in terms of cases overall. The next slide is the cumulative burden of confirmed cases. And we see over 93,000 cases that have thus far been confirmed. And we see the increase that we've seen over the last 24 hours, over 2,700 cases that were confirmed in the last 24 hours. Always important to mention that those were the fact that they were confirmed in the last 24 hours doesn't mean that they necessarily happened in the last 24 hours. That means that the lab result was issued or communicated in the last 24 hours, which is why they are here. But surely of those 2,700 cases, those are distributed over the course of the last 10 to 12 days, plus the last 5 to 7 days, which would be the ones that were awaiting a result. And that increase represented a 3.1% increase relative to the prior burden of disease. And so let's look at hospital occupation rate and availability. The information that we received last week was from 99,000 hospitals that were reporting information within the web of COVID-ready hospitals reporting information or statistics. And so we see how beds that are currently filled are 43% for facilities that are fit to treat COVID patients. And we saw how there was an increase towards 41, 43 over the weekend. We're now at about 41%. And logically, this is showing that general beds for gravely ill patients are being filled. People are coming in seeking medical attention or medical treatment. The occupation rate in the hospitals is increasing over the last few days, and this can also represent an increase in activity in every state. If we move on to the next slide, where we can see this distribution by state, we can see the increase or the decrease according to the state. If you recall, a week ago, approximately, the states that were over 40% of the hospital occupation rate there were about 4 of them, and now we can see the states that are over 40%. We can now look at Sonora, which is that bottom figure on the 40%. Almost half of the states are now at that benchmark. And so as more beds are being converted, more hospitals are being added, or their patients are getting better and being discharged, this number would not continue to increase or would even decrease. And so that's why it's important to be monitoring constantly what this hospital capacity is. And so if we move on to the next slide, this is typically referring to critical care beds, which has been indicating the increase nationally, and what states over a 40% rate of occupation. Guerrero State is also seeing an increase over what we had last week, and so this is indicative of the work being done locally and operationally as far as being able to keep availability for these beds for people who may need them so that they will have a bed available. If we look at the next slide, these are the statistics that speak to how this capacity has been increased. When the activity began in this network of reporting hospitals, there were only a certain number of hospitals that were COVID ready. As the epidemic grew, states were able to designate more and more hospitals for treatment of COVID patients. And now we're at this approximately 780, which is what we've had over the last 4 days, which is also indicative of how this has increased not just the number of beds, in this image, we can also see how the number of units, the number of hospitals has increased, which didn't initially need to be designated as COVID ready. It could see other diseases, but as it became necessary, they had to be converted specifically to COVID wings or areas. And so that's where we see this increase. So this would be the occupancy rate. And so we're going to update you on the Monday statistics. Is what we had been showing you daily. There were not a lot of changes day to day, and so that's why we're looking at the changes weekly. For example, in terms of the distribution by sex for people who have become ill, or also by age. And so let's look at the percentage of men, 56%. Basically, since the beginning of the epidemic, it's been at about 57, 58%. So that's a statistic that held steady, basically, for people that have gotten sick. And likewise, we can see in the blue and pink bars the distribution by age in terms of people who have been getting sick from COVID. And we can see the bulk of that is between 30 and 50 years of age. We can even see that 59-year-olds are key burden within this cumulative burden, because this is a total, or the age group that ends in 59. And so let's look at the next slide. And so now we'll look at this same distribution, but now just among deaths. Of the 10,167 unfortunate deaths that have happened thus far, we can see the increase among men are the ones that have died the most from this disease. We said we're at 67% here in this chart, which is basically 2/3 of deaths were among men. And we can see by age that we saw from here compared to that, this curve is moving to the right. And so older people, in comparison to the total number of people that are ill, more people that are older are unfortunately the ones who end up dying. And a key group between 45 and 69 years old is where there's also a lot of comorbidity for these chronic degenerative diseases and others, type immune disorders that contribute to people developing complications and dying. And so the next slide shows what these comorbidities have been. And we still see hypertension or high blood pressure, diabetes, and obesity as the primary comorbidities that have contributed to complications. But yesterday was a key day because we talked a lot about this. We were also looking at tobacco consumption as fourth among risk factors that are being correlated to complications and deaths. Keeping in mind that we're also looking at chronic diseases like kidney failure, COPD, cardiovascular disease, and to a lesser degree, immune disorders, asthma, and specifically disorders such as HIV or AIDS, which are diseases that cause immunosuppressive response. And so among these comorbidities, one of these comorbidities was found in 64% of deaths. So people suffered from at least one, if not one or two or more of these disorders. And so as has come up previously, 26% of the people that have died did not have any of these comorbidities that are shown here. And so let's recall that among these 26%, we would have to also include age groups, keeping in mind that being over 60 years old is also considered to be a risk factor. And so we could then adjust these numbers to see how many people could have died without having any sort of risk factor or comorbidity beyond the fact that, or unless they would have expressed that when they were interviewed, when taken as a suspected case. If they did not know that they had diabetes or high blood pressure at the time that they sought medical attention for COVID-19. And let's look at the next slide, which is the last in this group, which is specifically talking about the positivity rate per epidemiological week, which we talk about on Fridays when we look at the update on lab components. We've been at about a 40% over the last 3 weeks, but here the difference is that we can see how those work in function of uh, the condition that people were in when they sought medical attention. Let's not look too much at the drop in the week of the 22nd because that model is just now being put together. Last week, we started numbers as of the 23rd. So last week, over the course of the last 10 days, is where you see the bulk of the results that are still awaiting results. Also suspected cases. And so those are the week of the 22nd. But if we look at the week of the 19th, or week number 21, 19, 20, we see the positivity rate by clinical condition has been about the same. And so we're approaching 40%, which is what we were looking at, 38%. And then we see that the behavior of the curve has been about the same, although we've seen a decline among week 22 in terms of the positivity rate with respect to patients that are intubated compared to people who come in serious state. And so that would be the daily update on epidemiological statistics for tonight. Thank you very much, Dr. Alumia. And so I will provide a brief but substantive demonstration of how epi curves are looking for different cities. And so let's begin with Valle del México, metropolitan area. In what you see in the dark curve, you see the projection or prediction for 50%. I'll explain that shortly. The 90% curve, and the lower curve is 10%. And so as a point of reference, we'll look at the latest projections that you know since April, since March actually, academic groups of mathematicians that work with the health ministry put together these projections. And the way to interpret them is as follows. If we were to take a section, if we were to take a slice at any point in the curve, we would find that we have a line, or it's dotted line, a solid line, and a dotted line in that order from top to bottom. So 10%, 50%, and 90% as far as the cases for that week being in that position. And so between 10 and 90, there's an 80% gap. There's an 80% possibility that the observed cases would be found in that. And so let's look at these curves. This is for Valle de Mexico, and the latest date for cutoff of reporting information was May 30th. And so that's what's represented in the light red bars. And so generally speaking, as Dr. Alumia has said, and we've mentioned other times, confirmed cases, we look at the last 7 days. Why? This is a common practice in epidemiological monitoring in a lot of parts of the country. This happens in the US, Health Agency in Canada, the WHO, because we know that there is a lag between confirmation, which depends on a lot of technical elements, and then proceeding from that. And so there's no information to be drawn from that. And so this is purposely truncated. Although we have information up to here, we're not going to look at these 7 days, last 7 days. What we can see is that the prediction that was made at the time was that in the first week of May, between the 6th and the 8th, we would have the peak here, highest point of the curve, and that's exactly what happened. In the most recent prediction, which was for May 28th, this is what happened on May 5th. The original predictions were between the 6th and the 8th. And so I want to take this opportunity to clarify something which has been persistent as a misconception or something that
el
people have been
gobierno
confused about
mexicano dijo
among
que
the
esto
public.
sería
It's
en
been said that
junio
the government
y
said that the peak would be in
hay
June.
quien dijo que sería en mayo y seguimos
And
viendo
some
casos que
say
suben.
they said it would be in May, and we
Expliquemos,
still
experta.
were seeing an increase in cases.
Dijimos que
Let's explain.
no se pueden hacer predicciones
We said
para un solo
we
país
can't
cuando
make
el país es
projections just
geográficamente
for one
extenso.
country that is
¿Por qué
so
razón? Porque
large.
las epidemias
Why?
se comportan de
Well,
manera
because the
independiente,
epidemics
no se
are
coordinan, no se
behaving in
sincronizan,
different ways. They're
excepto
not
las que son muy
synchronized.
vecinas, como los
So we
municipios
have
conurbados del Valle de México
some
en el
areas
Estado de
that are
México
beside
y
the
la Ciudad de México,
Mexico
que
City
funcionan como una
metropolitan
sola
area.
epidemia. Pero las
And there we're
demás
seeing that
son
it
como si fueran
is a
literalmente
similar
países
epidemic and it
separados
behaves
porque tenemos
similarly.
una
But
gran
apart
extensión
from that, we have
territorial
such a
y aunque
huge
existe
country
movilidad entre las
and we have so
regiones y las
much
ciudades,
mobility between
esta no es
regions and
suficiente como para
cities, we
sincronizar
can't
las epidemias, no se
synchronize the
presentan al mismo
epidemics.
tiempo.
It's not
Lo
happening
mismo
at
pasa
the
en Estados
same
Unidos,
time
en Brasil, en
everywhere.
Canadá, en
In the
China,
United
en
States, in
Rusia, en
Brazil,
la
in
India, etcétera.
Canada, in
Países de
India,
grandes dimensiones. Países más
these are
pequeños,
huge
con mucha
countries.
movilidad
And
interna,
with smaller
finalmente
countries
tienen
where they
sincronía
have
de sus curvas
a lot of
epidémicas.
internal mobility, their
Entonces,
epicurves
desde
were
que se
more
incorporaron los
synchronized.
colegas
They were
matemáticos
more
y
similar.
matemáticas en marzo al
In
trabajo,
March, we had the mathematicians
desistimos de
working on
intentar
this.
tener una sola predicción para
And
todo el
we
país.
can't have
Lo que tenemos
one
son
single
predicciones para
prediction
cada
for the
una de las
whole
ciudades,
country. We're going to have
tomando
different
las de mayor
projections
tamaño
for
que
different
se consideran
cities.
más relevantes desde el punto de vista epidemiológico. Ahora bien, si uno toma
Now,
cada una de las curvas
if we take a
epidémicas,
look at each
como hemos mencionado,
epicurve, as we've
estas están
mentioned,
desfasadas
these
temporalmente
are
unas de
not in
otras
sync with each
y en
other, as I was
conjunto
saying.
uno puede
But together,
apreciar
you
cuál sería la
can
duración
actually
total de la
see
epidemia.
how long the
Si volvemos a
epidemic
lo
is
que
going
decimos
to
muy
last.
frecuentemente,
And that's
esta
something that
epidemia
we've been
no se ha
doing
acabado,
often.
esta
We've been
epidemia
telling
todavía
you the
está
epidemic is not over.
varias ciudades que
There's
están, como
still
vemos ahora,
numerous
en
cities,
una
and I'm
fase
going
de
to show
ascenso
you right
de la
now
epidemia
that are
y lo
on the
estarán
upturn
durante
in
junio,
terms of
algunas
the
durante julio,
epidemic. And this is
otras
going
incluso
to
en agosto.
continue through June, July, and for some
Entonces,
cities,
aquí está el
August.
Valle de México. Lo
So
que
this is the
destaco aquí
Valley
es
of
que
Mexico.
hay una
And what
tendencia
I'd like to highlight
decreciente,
here
pero
is the
también hay un
tendency that
exceso
is
de
going
casos con
down.
respecto a la
We
predicción
do
original.
still have more
Entonces,
cases than the
reitero aquí el
original
mensaje que
projection,
dijo
but I
la
would
jefa
like
de
to
gobierno de la
repeat
Ciudad de
again
México y el
what
gobernador Alfredo del Mazo,
Governor Sheinbaum
particularmente en
said.
la zona metropolitana del
And
Valle de
the
México,
metropolitan
tenemos
area
que
of the Valley
conservar
of Mexico
las
must
medidas de
really
seguridad
continue
sanitaria,
with
no
the
salir
massive
a la
mitigation
vía pública.
measures. And we really
La
want
siguiente.
to remind people not to go out in public.
Estas son las hospitalizaciones en camas
Here
generales.
are
Han tenido una suerte
hospitalizations for
de
general
estabilización en
beds.
el tiempo,
We
pero
can see
continúan
this over
todavía con
time,
unos números
and we can
importantes. La
see that
siguiente.
it's still significant
Y la
numbers there.
hospitalización en terapia
This
intensiva
is
también hay
intensive
según
care
las predicciones
hospitalization,
y se
which
encuentra
has
en
gone
esta
over
zona en este momento.
projections
Valle
in
de
this
México.
area, the Valley
La
of
siguiente.
Mexico, right now.
Esto es
This
Tabasco,
is
concretamente
Tabasco,
es Villahermosa, la
the
ciudad capital, la
city
ciudad más importante.
Villahermosa,
Ya
the
habíamos
capital
comentado
and
en
most
varias otras
important city.
ocasiones que
And
acabó
we've
teniendo un
talked
doble
about Tabasco
comportamiento
recently
epidémico.
because
Tuvo
we've
una
seen they've
primera
had kind
curva
of
que
a
ya se
double
encontraba en
hit
descenso
by
y
the epidemic.
desafortunadamente tuvo
Unfortunately, they
un
were going
repunte.
down and then
Esto
they
se
had an
explica muy
upsurge, a
probablemente porque
reemergence.
en los últimos días
And
de
what
abril y
happened was
primeros de
over the
mayo
last
hubo
couple of
una
days in
mayor
April and May,
movilidad en el
more
espacio
people were
público
out in
y
public.
esto es exactamente el
And that is
fenómeno de rebrote
exactly what
que puede
happened
ocurrir
that caused
y
another
hemos
outbreak to
advertido
happen. And
desde
we had
abril
been warning
cuando
about that.
se reducen las medidas
So
de
if we
sana distancia.
do get
Puede
more
ocurrir, esto es lo que
lax with
puede
the safe
ocurrir a
distancing
partir de hoy,
measures, then this
primero de
kind of
junio,
thing can
que
happen.
las medidas sanitarias
June
están
1st,
en manos
today,
de los gobiernos
every
estatales.
governor,
Que
the
quede muy claro,
states
no
have
se
the
han terminado.
power
No se han
to
terminado las medidas de
dictate what
restricción de
is
la
going
movilidad.
on in their
No se
states.
ha
They're the
terminado
ones
la
who are going to
jornada de sana
decide.
distancia.
I'm not saying
Simplemente
that the
ya no es
safe distancing
nacional,
campaign
fue
has
una disposición
ended,
general
but as a
por parte de la
general
autoridad
measure,
sanitaria
but
federal.
from the federal health
Pero en
authorities,
31
it
entidades
has
federativas,
ended. But in
prácticamente
31
deberíamos considerar
states,
también
we
a
also have to
Zacatecas, que se
continue
encuentra con semáforo
Zacatecas,
en
which has
anaranjado,
its
pero una
traffic light
tendencia hacia
in
arriba.
orange, but we've seen an
Todo el
upsurge
país
there as
debe
well.
mantener
And we have to
todavía
remind you, the
las
whole country
restricciones de
has to
movilidad en el espacio
continue
público y
reducing
solo entrará en
mobility
función
and
las
staying out of
actividades
public.
esenciales, incluyendo las tres nuevas esenciales. La siguiente. Villahermosa, hospitalización,
Villahermosa, here
lo
are
mismo,
their
excede ya la
hospitalizations.
predicción
We see that they've gone
discretamente. La
over the
siguiente.
projection a little bit.
Villahermosa, hospitalización en terapia
And
intensiva
also we
excede
have
poco más.
ICU occupancy higher than what the projections were as well. Let's go a little bit more quickly through this. This is Quintana Roo. We can see that this is a little bit longer than what the projection had shown, but we do see that they are going down. There's still more time to go. We still want them to get down to that point where very much at the bottom where there are very, very few cases. And that's where we can start to open up mobility a bit more. Here are hospitalizations. This is great. They've kept things really under control there. This is ICU. It has gone a little bit over the predicted curve. Here is Sinaloa, Culiacan, Sinaloa. We can see that they are also showing a downward trend. We still have 20 days to go until they get to the lowest transmission rates. These are hospitalizations in Culiacan. And we can also see here people who are in the ICU. Here it has gone over the projection. Next. This is Tijuana, Baja California. Also, we can see it got to its maximum point, and I want to point out here, see this, our projections have been very much on point. And we can see this downward trend happening there. And here's Tijuana almost reaching a point where they're going to have more stability, but there's still significant activity going on. This is ICU, which also went over projections. Veracruz, they've always had a very well organized epicurve right from our very first projections. This is the epicurve that we observed. It's a shorter curve, but more intense. And we still have about 15 or 18 days to go for them to be in a safe spot. This is going up and down as our projections predicted. Here's intensive care again. It's gone over the projections. And there are other things going on here too, because when we have ICU beds with a really high occupancy rate, then we also have to remember about how successful ICU is being. What they're trying to do is keep people alive longer. Obviously, people will be staying longer in the ICU, but we will be saving lives. And God willing, if we can take a look at those, how many cases those are, we can see how many people also came out healthy. Here's Oaxaca. This is their very spread out curve that we had at first projected. And now we can see that it's spiking and we're not sure about the trajectory here. We really need Oaxaca to keep those safe distancing measures very firmly in place, stay out of public, and to make sure that we control this as well as we can. We have the sectors, the public sector and private sector. If everybody gets on board, then we will be able to keep on par with this projection. Here we go. Here's the middle point of that epicurve, and you can see that compared to the original projection. Here is the ICU. They've got it under control, but there's still a way to go. Here we have Cuernavaca and their similar epicurve, which is also similar to the epicurve in Cuautla. So this is great because of safe distancing has been firmly in place. And we can see that it is going down a little bit, but we're not quite out of the woods yet. Here we see hospitalization in Cuernavaca. There's still a lot of demand for hospital beds. And here's the hospitalization ICU numbers. We're still far from the projection of the 10% that had originally been predicted, but we still have available beds. This is Acapulco Guerrero. This has gone far outside of the projection. Remember that 2 weekends ago, we were at a real crucial axis turning point. And the good thing is there's been a great positive response from the government of Guerrero and also from national health authorities like ISTE and the Mexican Public Health System, who have been coordinating through Rosario Vargas, and she is working on coordinating with the state. We have to increase capacity to be able to deal with COVID patients, and we have sent ventilators to them, and we're working on those occupancy rates. This is hospitalization, and in terms of the projection, it's still far from hitting that critical point in terms of occupancy rates at hospitals. This is the ICU hospitalization information. It's quite full. We still don't know at what point is it going to start to go down. So we need a couple more days here to understand what's happening, maybe 7 to 15. Guadalajara, Jalisco, they have a slow movement of the epidemic. It's still very far from the projections about what could happen over the next few weeks. We're going to see the same in Monterrey, and we must underscore again that these epidemics are hitting some places later. So we have to keep those mobility restrictions in place, basically until necessary. So those are probably going to be the last 2 epidemics. Here's hospitalization in hospitals in Jalisco, and we can also see the ICU hospitalization. And we can also see how it's more clearly following the projection. Here's Monterrey, Nuevo León, very similar pattern here. This is going to be a long epidemic. We have to think here, we started over here. These were the first days of May, and so it's probably going to be stretched out until October. So in those 2 big cities, the second biggest and the third biggest cities in this country, we have to be very patient. We must be patient and keep these restrictions in place. We must be disciplined. We can't be jumping out of our quarantine. This is Monterrey hospitalization. This is ICU, and we can see that that's following quite faithfully the projections. I think that's the last slide. Okay, now, Sir Zoe Rebledo, please go ahead, and then we'll go to Q&A. Thank you so much, Dr. Lopez-Gatell. Good afternoon, good evening, everyone. Good afternoon to everyone who's watching us. I'd like to go quickly through this. We're going to talk about our healthy return to the new normal. I think the message has been crystal clear. New normal does not mean that we're all going back to our daily lives that we used to live. It actually means the exact opposite. As we've explained here, it's going to be called the new normal, and we're going to ramp up some activities, some economic activities. Some companies are going to get back to work. And what they have to do for that, it has to be healthy, safe. We don't want one person who is infected to lead to an outbreak. We also have to really take care of workers and employees' health. We also have to have solidarity. We all have to be on board. We're all responsible. We're all waving the banner of responsibility. And if we know we can go back to work, but we're not part of an essential company, please don't try to say, okay, we all have to be working starting June 1st. Could you go to the next slide? What are the essential businesses? Let's all identify them and be very clear about this. Now, banks, the pharmaceutical industry, agriculture, supermarkets, the media, old age homes, companies that have to do with warehousing and cargo, UPS and FedEx, telecommunications, funeral services, chemical and cleaning products industries, suppliers of essential activities, and then our 3 neo-essential, which we've been discussing over the last few days, auto parts manufacturing, construction, and mining. All the companies, all the businesses that are tied to those three neo essential services will have to be taking quite serious measures. If there is some sort of a problem and we see that, then we're going to have to adjust the measures. So it's very important that we're all informed. So with these three essential sectors, they were ramping up their economic activity over the last 2 weeks. And so we were seeing that leading up to June 1st, they would be self-evaluating themselves and recording what was going on and making sure that their return to economic activity is hunky-dory, is positive and right. Now, other people have an obligation. We have to register ourselves on the website that we've given to you. You need to self-evaluate. You might have to wait, but you do need to register. And what happens is you'll receive a letter automatically. So, how are we doing today? Next slide. We have 2,999 companies that are registered, and that happened previously. Transportation, mining, businesses related to that. And then we had many also registrations for people who are part of essential activities. And something that's been really great is that all these sectors, through their chambers, they've had a positive response in seeing how people have signed up. I'm sure that tomorrow we're going to have more. But I have to insist, essential businesses also have to register and they also have to self-evaluate. So if we look here, we can see distribution by state, and we can see where there is more economic activity having been registered, where more companies have registered themselves. And this is the projection of how that's been happening. May 31st, yesterday, was the day with the most registrations and self-evaluations being entered onto the website. And many of those were essential companies, essential businesses. What we would like to continue to insist on is how the new normal looks. What does it look like? How do we normalize it? How can we tell something is different? For example, on the top, this was a picture from a bank. A bank, for example, in the new normal, has to ensure that they have these lines painted on the ground so that people know where to stand. This is really valuable for people's health, for employees' health. Just putting those circles outside on the sidewalk so that people know where they have to stand is really good. This could make the difference between a client of the bank getting infected with COVID or not. What about at a convenience store? Before, basically, everybody was packed in there. Everybody was making a line and queuing up. But now, the new normal, you can see this store and it has a piece of plexiglass between the employee and the clients. This is a physical barrier made out of acrylic, and this ensures safety for both people so that during these such common and necessary interactions that they're not going to be hit with spittle. And here's another picture from a supermarket. Before, on top, and downstairs, below, the new normal with marks on the floor so that people know how far to stand away from people. And so what this does is helps the flow of people within the supermarket. So for example, in some aisles, they're going to only be going one way, and in another aisle, another way. So this is not just about workers, but with these two very important examples, we have to think, about the clients. It's also very important for clients to be able to understand if someone has opened up their business, but they're not doing things well, then they would probably report on them. Here are pictures from a big factory, and this is how it might be for workers to have physical barriers between them and be using PPE. I want to show you what the letter looks like that is sent out by Social Security automatically. And this is for evaluating yourself on the website. It says, "Dear company member, you have filled out your registry, and we want to tell you the following. Your application has been approved. Congratulations for carrying out this health safety protocol for your workplace. And this is to help you with your workers. We want to remind you about your self-evaluation that you will need in order to be verified by the Secretary of Labor and Social Prevention. We will keep you updated about the traffic light, and we will let you know about this as well online. It also tells you about what level of health alert we're on. And if someone is a supplier for an essential company, this is very important. They have to remember that we have an area that is on the highest level of sanitary alert. And that is tied to the sector that works with essential companies. If that company does other types of activities that aren't related to essential activities, they can't start up their production lines. Many of us who are involved with companies like this is, for example, factories in states like Guanajuato. If they're making steering wheels for cars, then they can have their production line open. But if they make shoes, they can't turn up their production line. So this is an example that might clarify that. And we also invite people from your business to understand our health measures and going to our website, http://eames.mx.com. And you can take a free course there. People's employees are welcome to take those courses, and let's all take care of ourselves. Now, when we're talking about training, we have to be updated on what trainings are available. We have to understand which measures have been adopted and which are still waiting to be adopted. All of these things, we've already adopted these measures, but we are going to have to adopt other measures at our workplaces. And we have many courses online that are trainings that are available. We had 84,000 visitors to the website, and that's very exciting for us. And anyone can do this. Anyone can get on there. We can have business people. Everyone has to be doing this effort together. We need to take care of ourselves together, and we have to have a safe, secure new normal. And we're very proud of Mexican solidarity so far. That's all. Thank you so much, Mr. Zoe Rebledo. You, and then you, Daniela. Thank you, Doctor. Thank you very much. Blanca Aguirre from Notimex TV. I wanted to ask you about last Wednesday, your virtual meeting with the senators. From there, the PAN Senator Alejandra Reynosa, she said that she felt offended that you had been evading her questions. And pivoting off of that, she wanted to ask you for a public apology. And also, Governor Sheinbaum also made a comment lately too. She was saying that very soon we might have the vaccination for influenza, that we could perhaps bring that out earlier so that influenza and COVID weren't knocking heads at the same time. Well, with respect to Senator Reynosa, Alejandra Noemi Reynoso Sanchez, from the PAN, the
Efectivamente
National
tengo
Action
conocimiento
Party?
porque en distintos medios
Well,
sociales,
in
redes
some
sociales,
social
ella misma
networks,
expresó estas
she
inquietudes. Entiendo que
expressed her
después
concerns,
correligionarios de su
and
partido lo expresaron
then
y
some other
también
people from her party
otros
also expressed some
colegas
concerns,
del
as
Senado,
did other
tanto
colleagues in the
senadoras como
Senate.
senadores. Hasta donde tengo entendido,
As far as I understand,
eh, sensación de que fue ofendida
the
por una
fact that
parte
she was
no es tanto
offended
porque
by
no haya
me,
respondido a sus preguntas. De
well,
hecho,
I mean, she
de
was
acuerdo
offended because
a
I
su
hadn't
memoria, he
answered her
revisado
questions.
la grabación
I've
de
reviewed the
videoconferencia.
video
La verdad es que
conference,
preguntas
and
que
more than
eran
questions, they
señalamientos
were actually
y las
finger
preguntas
pointing.
pues estaban basadas en un
And her
principio
questions were
de
based
algo que
on
no había
something
sucedido.
that
Por
had not
ejemplo, me
happened. For
preguntaba si
example,
al
she
decir que
asked me,
usted
"Do you
no había
regret
tomado
not
decisiones
having taken
oportunamente,
decisions in a timely manner?"
está suponiendo que
Well,
no
she
había
was
tomado
supposing, she was assuming that
decisiones
I hadn't
oportunamente,
made
a lo
timely
cual yo pues muy
decisions. And
respetuosamente, no solo a ella,
respectfully,
sino
I
al
said to
resto de
her
quienes
and to other
me hicieron
people who
preguntas,
also were asking
que
questions
primero
that
presentaran las
first, could
pruebas
you show
concluyentes al
me the
señalamiento que me parece casi
evidence of that?
acusatorio.
Which, you know, she
Pero
was
más
quite
allá de ello,
accusatory.
parece que el
But
señalamiento que ella hizo es que yo podía haber incurrido en una
I
práctica
could
misógina,
have,
de
maybe she
rechazo a la
was saying, is
mujer o
this going to
de
be like
discriminación
misogyny or
hacia las
discrimination
mujeres,
toward
representadas en este
women?
caso por ella. Eso me
That
preocupa
worries me.
porque definitivamente mis
That worries me
convicciones que vienen de
because
mucho
that's
tiempo
not what I
atrás
believe.
son muy
And I've been
claras.
very
He contemplado
clear.
siempre por el respeto, la
And
defensa, la
I
promoción de la
support the
igualdad de los
respect,
géneros, no
gender
solamente entre
equity,
hombres y mujeres, sino entre
respecting
una enorme diversidad
gender
de
equality,
identidades
respecting men,
genéricas que
respecting
existen en
women.
el mundo. Y me
And
parece que sería
so
preocupante que
it
por
seems very worrying
alguna
that
circunstancia
because
como
of
esta
some
se
circumstance
malinterpretara.
like what happened, that this would be
No es mi intención
misinterpreted.
ofender a
I
nadie,
don't
ni
want
a la
to offend
senadora Reynoso,
anyone,
ni
not
absolutamente a
Senator
nadie.
Reynosa, not anyone.
Respeto profundamente,
I
como lo
very
expresé ese
much
día y lo
respect
seguiré
her, and I said
expresando,
that on
la
Wednesday.
separación de
And
poderes.
I think the
Estoy consciente que
separation
yo
of
soy un
powers is
funcionario
very
que estoy
important,
suscrito a uno de los
and
poderes de la
I'm
Unión
subscribed
y
under those powers of the
los otros dos
union.
poderes merecen
And
todo mi respeto
everyone,
y
all,
toda
each
mi
level of government
admiración.
has my respect,
Entonces, también
and I also
recordaría que
consider
se
them very much.
interpretara
So I'm
distinto.
very worried about
Ahora,
that being interpreted in that
pienso,
way.
no solo ahora, sino lo he pensado
But
siempre,
I
si
think
alguien se
that if
siente
someone
ofendido y pide
feels
una
offended and they
disculpa,
ask for an
ese alguien
apology,
tiene
that
derecho a que
person
se le
has
dé
the
una
right
disculpa
to give an
y yo no
apology.
voy a
I'm
cuestionar
not going
si es
to
válido o
question if
no
it's valid or
su
not,
percepción
or what her
de que
perception
fue
is
ofendida.
of being
Puedo
offended or
decir
not. I can
públicamente,
say
no tengo
publicly,
intención
I
alguna
have
y la tuve en ese
no
momento
intention,
de
not at
ofenderla
that
y
time,
no
ni at any
terminaré.
moment, to offend
Y le pido
her
una
or
disculpa.
anyone.
Le pido una
And
disculpa a la
I would
senadora
like to
Alejandra
ask
Noemí Reynoso
you
Sánchez,
to apologize
legisladora,
to me,
senadora,
Alejandra
representante nacional
Reynosa,
por Guanajuato
Alejandra Reynosa
del Partido Acción
Sanchez.
Nacional. Le pido una disculpa,
I
senadora,
would
si
like to
la
ask
ofendí.
you, I would like to
Créame que no
say
fue mi
I'm
intención,
sorry,
pero desde luego
but
el planteamiento que usted
what
hace
you
me ayuda a
were
identificar cómo
suggesting,
pudieron haberse
it
dado las
did help
circunstancias
me
y de qué
understand
manera
how this
podría ser
circumstance could have
más
gotten to this
efectivo en
point,
el
and
futuro
perhaps maybe it
para
can help
no
me understand how
ofender
to
a
be
alguien
a little bit
más.
more effective
Le pido una
in the
disculpa
future and to
y le
not
agradezco su señalamiento
offend
porque me
anyone else. And I
ayudará
would like to offer an
a
apology.
desarrollar mis capacidades de
And
comunicación. Gracias por su observación.
I
Gracias,
will be
senadora.
working on my communication
Sobre la
skills.
vacuna de
Thank
influenza,
you, Senator.
pues yo coincido
About
con lo que
the
dice la doctora
vaccination
Sheinbaum.
for
Sería muy
influenza,
deseable anticipar la
influenza,
vacunación
I
contra
think
influenza.
exactly
Hay
as
una
Dr.
restricción.
Sheinbaum said,
La vacunación
there
contra influenza
is
se
a
vacuna inicialmente
restriction
para
because the
octubre,
vaccination
generalmente antes de
itself is
octubre.
not normally
Esto por
available
el ciclo
before
de
October.
fabricación.
That's
Las
because
vacunas
of
contra
its cycle
influenza
of
se producen
manufacturing.
a partir de la identificación de las
So
cepas
we will
relevantes. En
be
febrero, la Organización
asking
Mundial de la Salud
for
reúne al comité de
support
personas
from the
expertas
WHO and
para
from other
seleccionar
health
las cepas
institutions
correspondientes, los
so that we
tipos
can
y
choose the
subtipos.
strains, the
Después,
proper
aproximadamente en
subtypes,
mayo,
types,
junio,
so
se
that we'll be
hace
able
la producción. En
to
julio
ramp up
sale
production
ya
perhaps
a
in
disposición
June, so
de
that in
los distintos
July
mercados. Se
we
distribuye
might get
finalmente
some
hasta septiembre
distribution
y
happening.
típicamente en octubre en todos los
Usually in
países del hemisferio norte
October,
empieza
everyone
esta
in the
segunda
Northern
ola que llegue.
Hemisphere
Desde
starts
luego
to
habremos de
receive their
utilizarla.
influenza vaccination. As
Muchas
soon as we
gracias.
get that, we're
¿Quién
going to
seguía?
apply it.
Seguía Hans Salazar,
Hans
por favor.
Alazar, you're next.
Doctor
Doctor, there's 1 minute and a half left. I wanted to ask you a question, and then maybe if you could answer tomorrow. So, because, of remember what happened last time. Thank you so much. Thank you. I'm from CMT Noticias. Hello to all of you. In terms of Morelos, there are many people who are sick with COVID, and there isn't medical attention necessary for them. 4 people have died in an area that is compounded with many more people. There are 80 people who are very sick, and they haven't received they haven't received paracetamol. I have the informations that I can give that to you. The other subject is women. Unfortunately, with this new model for Insabi, they have been left adrift in terms of cancer attention. It's about 250 women who unfortunately have been dragged from here to there. They went to COE, they went to FOCAM, and now they're saying, no, the government's saying, no, we don't have the resources, according to what had been explained here. I don't think we need to repeat that now. I don't know who would they be able to speak to. Insabi has not provided any answers. Some of these women have been attended to at other areas, and they're being charged at other hospitals, and they have those receipts. So could you just please tell me who I can give this information to? This is very sensitive. These women are desperate at this point. They are really feeling horrible about this. I don't know if maybe tomorrow you could talk about the epicurve in Chiapas, and also people who have recovered. How many people have recovered? People are always asking about this. This is something that I think you might want to pick up again, because we'd also like to know how many people who have been intubated. Could you give us a total number of people who have been intubated, and how many of those diseases that are people have been more inclined to have in terms of tobacco, diabetes, do you have those numbers of who has recovered? If you could give me that information, I don't know, today or tomorrow, that would be great. Of course, we will take all of that into account. Thank you for the complaints, for bringing up those concerns, especially for health protection. And we're going to follow up with Insabi Morelos. We're also going to follow up with them. We'll follow up with the Secretary of Health for the state. And in terms of proposals for information, we have that. We have the occupancy rates, and there's more details right in there about how many people are intubated. And we also have that database that tells us how many people the percentages that we show here are multiplied by how many people are there. What's this? This is the daily cutoff date. This is the information that we tell you on the daily cutoff numbers with, for example, with the number of people with comorbidities, and we've seen a really constant percentage there. But in terms of intubated people, yes, we have that information and we'll get it to you. Thank you so much. We're going to end there. It's 8:02. Thank you. Have a good night.